Navigating the healthcare system can be confusing and overwhelming. The good news is, you're not alone. PEHP Health and Benefits is committed to helping you find quality care at affordable rates. This video guide will help you understand basic health insurance terms, how to maximize your PEHP benefits, and give you the tools you need to make the best healthcare decisions for you and your family. Plan, network, deductible. You've heard these words, but what do they mean? In this section, we explain the most common health insurance terms you need to know to keep more money in your pocket. Your PEHP plan outlines your coverage, and your network is where you go for health care. For example, a doctor's office or hospital. It's always important to see doctors and other medical providers in your network for the best deal. Otherwise, you may be subject to balance billing, which we'll discuss later. Search for quality care in your network when you log into your PEHP account. So how does health insurance work? You may be wondering how and when your PEHP plan pays for services. Here's a quick snapshot. When a new plan year begins, you have certain costs you pay before PEHP begins to pay for your health care. Your deductible is the amount you must pay first before PEHP begins to pay its portion of your claims. The amount varies based on your plan. Your coinsurance is a percentage of the cost you pay for most medical services once the deductible is met and until you've reached the out-of-pocket maximum. Your out-of-pocket maximum is the maximum you pay out of pocket for covered services in a plan year, after which PEHP pays 100%, as long as it's a covered benefit in your network. Your copay is a set dollar amount you pay for a service. And here's some great news. Preventive services such as an annual physical exam and flu shots are paid at no cost to you. PEHP always covers 100% of your preventive visit, even before you meet your deductible. Here are some other health insurance terms you should know. In-network versus out-of-network. In-network refers to healthcare facilities and providers that are contracted in your PEHP network, such as Advantage or Summit. You always get the best benefit by visiting doctors, hospitals, and other providers contracted in your network. Out-of-network refers to healthcare facilities and providers who are not contracted in your PEHP network, and if you visit them, they may balance bill you. Balance billing happens when an out-of-network provider sends you a bill for full payment of services. This happens because out-of-network providers don't have a pricing agreement with PEHP. PEHP only pays the in-network rate. You can avoid balance billing by always seeing in-network providers. Some services require pre-authorization. To get it, your doctor must call PEHP. Most doctors know how and when to do this, but it's your responsibility to verify. Otherwise, your benefits could be reduced or denied. Visit the website on your screen to see a list of services that require pre-authorization. While PEHP covers most medical services, we don't cover certain procedures that are not medically necessary, experimental, or cosmetic. Some of these include home births, birthing centers, and cosmetic surgery. You can see a list of limited and excluded services in your master policy when you log into your PEHP account. If you want to get a medical procedure not covered by PEHP, you may be able to use your HSA or Flex money to pay for charges. Make sure to visit the IRS website to find a list of qualified medical expenses for HSA and Flex accounts. Finding quality care at the right place is important. We have several cost comparison tools that help you shop for the best value and the best providers. To get started, simply log into your PEHP account at pehp.org. When you log in, you can find doctors and other healthcare providers in your network, see provider cost information, see cost estimates for common procedures, and read reviews from other PEHP members. Plus, you can find lower drug costs by shopping for any medication available through your drug benefit plan. These cost comparison tools are just one way we strive to make healthcare costs transparent, so you decide where to go for the best care. Your PEHP account also gives you access to see your claims history, see your spending amount towards your deductible, see your benefits summary and master policy, make changes to your contact information, and see which plans you are eligible to enroll during your employer's open enrollment. PEHP is committed to giving you the tools and information you need to take control of your healthcare costs. To save money, make sure you get the right care at the right place. This graph shows you the average cost by type of medical facility. How much you pay for medical services largely depends on where you go for care. As you can see, rates are always higher if you go to the ER or hospital. Some services can only be done at a hospital, but others, such as lab work, radiology, scheduled surgeries, and urgent care can be done in other settings. If you don't have a medical emergency but need immediate medical attention, visit the nearest urgent care clinic. And if your condition is minor, such as an eye infection or sore throat, consider consulting a doctor online through your eCare benefit for 24/7 urgent care. Another way to save money on health care is to visit PEHP value providers. They offer lower out-of-pocket costs to PEHP members. These include quality small clinics, labs, large specialty clinics, and other discounted healthcare providers. So the next time you need care, don't forget to visit a PEHP value provider for quality and value. Don't fall into one of the many healthcare traps. Here are some common issues you should know to avoid unexpected or unnecessary medical bills. Watch for hidden providers. A hidden provider is generally someone to whom your doctor sends your blood to be tested or an X-ray to be read. If it's an out-of-network provider, they may balance bill you. Don't assume your doctor will send your blood sample for testing to an in-network provider. Make sure every person and every facility involved in your care is contracted in your network. Routine visits for preventive services are covered at no cost to you when you see a doctor contracted in your network. However, you'll be billed if you get additional services at this visit. An additional service could be if your doctor treats a past or current condition. Ask your doctor how the visit will be billed. PEHP pays based on how it's billed. Always ask where your lab samples are being sent to avoid unnecessary large bills. Just because your doctor is in your network, don't assume the lab he or she uses is too. All genetic tests require pre-authorization. Unlike other simple blood tests that may cost between $6 to $100, genetic tests can exceed $5,000. So even when a test is covered, your portion of the bill can still cost you a lot of money. Make sure you decide the test is worth it before you agree to it. Prescription drug prices are rising at an alarming rate nationwide, but PEHP is taking steps to help protect you from high costs. To get the best deal, use drugs in the PEHP Preferred Drug List. It's a list of prescription medications available to members at lower costs. To see the Preferred Drug List and learn how pharmacy cost sharing works, log into your PEHP account and click on Prescription Drug Benefit under the My Benefits menu. Cost differences can sometimes be dramatic among equivalent drugs. When you're logged into your PEHP account, search for coverage and pricing for any medication available through your drug benefit plan. From the My Money menu, find Medication Costs to compare medication prices from different pharmacies and home delivery service for 90-day supplies, which are often less expensive. And don't forget that generic drugs are safe, effective, and produce the same effects as the comparable brand names. If you're currently taking expensive medications, you may want to consider getting them from a quality pharmacy in Mexico. The PEHP Pharmacy Tourism Program allows you to fill 90 to 180-day supply of certain medications from Mexico to help you save money on your prescriptions. PEHP will coordinate travel and cover your round-trip airfare from Salt Lake City to San Diego, as well as transportation to and from the medical clinic in Tijuana, Mexico, and, if needed, lodging at a designated hotel in San Diego. Visit the website on your screen to learn more. If you're traveling or living outside the state of Utah and need medical care, your PEHP plan still covers you. Just make sure you visit a PEHP contracted out-of-state provider. If you're living out of state, it's important that you notify PEHP. We'll make sure your claims go through our out-of-state network to pay the lowest costs. This applies to covered family members as well, such as children at college in another state. If you're traveling or living outside the country and need medical care, just send us a copy of the foreign claim and a receipt of payment, and we'll reimburse you for covered services up to the in-network rate. Remember that for minor health issues, you can consult a doctor remotely with your eCare benefit from anywhere, anytime. Please note that if you travel outside of Utah specifically to seek medical care, PEHP will not pay for services unless you get pre-authorization from us for a covered service that is not available in Utah. When you're covered by 2 or more insurance plans, PEHP uses state guidelines to determine which plan pays your claims first. For example, your employer's plan is primary for your claims and your spouse's plan is secondary. The primary plan covers the major portion of eligible bills, and the secondary plan may cover any remainder. Coordination of benefits can be complex. Call one of our health benefits advisors to help you decide if you're better on one plan or 2. And remember to keep PEHP informed when you or a family member add or lose insurance coverage. This helps ensure your claims are processed correctly to avoid unnecessary charges. If you pay cash for a covered service, you can get reimbursed by PEHP. Sometimes providers will give bigger discounts directly to the member if they pay in full at the time of service. Just submit your receipt to PEHP for reimbursement or for a credit toward your deductible. Log into your PEHP account and find the reimbursement form under the My Benefits menu, then Self-Pay Medical form. If you recently got married, divorced, had a baby, or any other qualifying event, you can add or drop family members from your PEHP plan at any time. A qualifying event includes birth or adoption of a child, marriage, divorce, and other life events. See all qualifying events when you log into your PEHP account and make changes as necessary. It's important to notify PEHP immediately if you have a qualifying event. Call PEHP at 801-366-7555 or use the Secure Message Center. Other changes to your PEHP plan can only be made during your employer's annual open enrollment. Eating healthy and staying active are key to helping delay or prevent health issues in your life. PEHP offers many wellness programs, tools, and resources to help you take control of your health. Rebates are also available, giving you an opportunity to earn cash rewards for healthy behavior. If you complete an annual biometric test at a Healthy Utah testing session, you can get a $50 rebate. You can sign up for a biometric test when you log into your PEHP account. Look for the registration link under the My Health tab. In addition to Healthy Utah testing sessions, PEHP members can also earn rewards by participating in other health and wellness programs. Find a program that's right for you and start today. Visit the website on your screen to learn more. Life struggles can take an emotional toll on you. If you're struggling with anxiety, depression, substance abuse, or any other mental health condition, you're not alone. There is help. Your PEHP mental health benefit covers treatment for specific mental health conditions, but you must have a diagnosis to use this benefit, and all providers must be contracted in your PEHP network. Pre-authorization is required for some mental health services, including all inpatient mental health services, day treatment facilities, and intensive outpatient programs. Call a PEHP mental health case manager to see which benefits apply to you. If your PEHP benefits don't cover a service you're seeking, ask your employer about any employee assistance programs or life assistance counseling available to you. You can also find local mental health resources at 211utah.org. PEHP has dedicated and qualified staff ready to answer your questions about your PEHP benefits. From benefits advisors to health nurses and wellness coaches, PEHP is committed to helping you navigate the healthcare system so you make the best decisions for you and your family. You can contact one of our team members Monday through Friday from 8 a.m. to 5:30 p.m. You can also send us a message anytime via the Secure Message Center when you log into your PEHP account.